Hello and welcome. We're here today to talk about the learning and key messages for Northamptonshire Safeguarding Adult Board's Safeguarding Adult Review 022 TO. During the course of this session, we may refer to the Safeguarding Adult Review as a SAR or a review, but we are talking about one and the same thing. My name is Suzanne Binley and I'm the business manager for the Safeguarding Adults Board here in Northamptonshire. I'm joined by three colleagues today, Sylvia Manson, who's the independent author.
Hello.
Georgette Fitzgerald, who's our SAR subgroup chair.
Hello.
And Chloe Roberts, project officer for the Safeguarding Adults Board.
Hello.
The aim of this session is to provide an overview of the SAR, the findings, the learning and the key messages. And Georgette will now take you through some of the background to the case.
Under Section 44 of the Care Act, the Safeguarding Adult Boards have a statutory duty to carry out Safeguarding Adult Reviews. We refer to them as SARs. So there must be a review when an adult with needs for care and support, where neglect or abuse is suspected and there's reasonable cause for concern about how agencies have worked together. So the Northamptonshire Safeguarding Adults Board has a specific responsibility for determining whether a SAR is needed for adults that live in Northamptonshire. The key purpose of these reviews is about learning. It's not about blame. A SAR is a supportive multi-agency process where agency contact and practice is looked at and identified, and reviews need real openness and critical analysis. They need to explore the decisions made and the actions taken. Gaps in practice will be identified and good practice is also recognised. Recommendations are made as part of the reviews and they're made to change or improve practice and services in the future. SARs are about learning lessons and making improvements, especially in the way we all work together to safeguard adults at risk. It's not about apportioning blame to individual people or to organisations. Northamptonshire Safeguarding Adults Board maintains oversight of the agency actions. Just a couple of general points about SARs. They're led by people who are completely independent to the case, in this case, Sylvia. They're supported by agencies who have worked with the adult, but the panel members are people who haven't directly worked with the adult. And families and key personal contacts are also involved in contributing to the review. The Safeguarding Adult Reviews are usually published, and for us, they'll be on the Northamptonshire Safeguarding Adults Board website. So this referral is about Tio. Tio died in October 2020, having been fatally injured on a train line. Tio had mental health needs and had been discharged from psychiatric inpatient care just 2 weeks before the fatal incident. The review looks at the circumstances of Tio's death, including the systems and multi-agency support that surrounded him and his mother. A few of the key areas in the terms of reference include how effective the assessment of needs and risks were, and the quality of care to meet those needs. Whether agencies met relevant practice guidance, policy and legal frameworks. How effectively agencies communicated and worked together in the care of treatment of Theo. And factors that influenced agency responses, including the impact of the COVID-19 pandemic. I'm going to hand over to Sylvia, who's going to take us through key aspects of the review.
Thanks, Georgette. Just to give you a little bit of background about Tio, as Georgette said, Tio had mental health needs for a number of years. He was in his early 20s. He and his mum had moved to Northamptonshire some months earlier from a European country. Tio spoke English well. His mum, English was her second language. And Tio developed mental health problems, schizophrenic illness, shortly after moving to the UK. Very sadly, Tio's dad had also had mental illness. He himself had schizophrenia, and he died about 2 years before the scope period for this review. Tio's belief was that his father had died by suicide. So the scope period for the review looked at the last 3 months of Teo's life. Teo's mental health had deteriorated. He had previously had a short period of inpatient care in hospital, but he'd been managing in the community for some time. He and his mum had lived in rented accommodation. It was a house of multiple occupancy. Neither were really very happy with where they were living, but they were being supported through mental health services. Sadly, in 2020, Teo's mental health, he had a relapse in his mental health needs, to the point where the mental health services involved felt that he needed a hospital admission. There was a lot of concern about how ill he had become, and an assessment was set up, and he was admitted to hospital under the Mental Health Act. He had a short term in hospital and recovered well, actually. He was only in hospital for about 3.5 weeks. He was stabilised in terms of his care and treatment in hospital, and planning for discharge began. Teo was discharged back to his care coordinator, who he knew well. There was a discharge plan in place where he would be followed up by community services within 48 hours. And about 2 weeks, sadly 2 to 3 weeks after Teo had been admitted, he was found nearby on a train line, or next to the train line, by the British Transport Police. The police were very effective in terms of identifying concerns about Teo, and took him to the local emergency department for assessment. He was seen briefly by a member of staff at the emergency department there, and he denied having any concerns. There were no worries. He didn't want to be seen by other services, and so he was discharged back home. Very sadly, a week later, Teo died fatally on that same train line, in that same spot where he'd been found a week earlier. So that's really the background for the review, and we wanted really to explore those circumstances that surrounded the last 3 months of Teo's life. So Suzanne, do you want me to go through the kind of key findings?
That would be really helpful, Sylvia, thank you.
Okay. So our first point really is to try and set some of the context for understanding suicide. And we looked in the review at some of the learning from the National Confidential Inquiry into Suicide and Safety. And that's a big body of research that happens annually in terms of examining the circumstances of people who die by suicide. We know from that research that understanding and preventing suicide can be very complicated. Very sadly, we know that people with mental health needs are at high risk, particularly for illnesses such as schizophrenia. We know that there are illness-related factors, so when somebody's acutely unwell, also when somebody's known to be admitted to hospital, can increase the risk of suicide during that period. And we know that there are particular times when factors related to suicide risk increase, such as at the immediate period post-discharge. There's also important psychological and social factors which we know heighten people's risk from dying from suicide, and those are where people socially might be disconnected from their communities. They might have instability in terms of their housing provision. Psychological factors, so we know where people are coping with loss, and when people have had suicide within their own family, those kinds of factors increase risk, along with areas such as not using medication, using illicit substances, using alcohol. So there's lots of factors that are known to increase risks of suicide. So although those factors are known, what we also understand is that accurately predicting a group of people who may well go on and die by suicide is really difficult. So although risk factors might be known, many people actually have those risk factors, and thankfully most of those people don't then end up ending their lives by suicide. So it's really important, as Georgette said, to be careful not to have hindsight bias and to really understand what was known at that time and to identify factors that could have worked better, really, without using that retrospect to slant our understanding of what should have happened. So I suppose that the first important thing to say is there was good practice. So we know from research there's standards for safer care and for suicide prevention, and many of those standards were actually met. There was good practice in the period leading up to Teo's admission because there was good response when people were concerned that his mental health was going downhill. There was good joint working between police, the approved mental health professionals, Teo's care coordinator. Those groups all worked together and were responsive to Teo's mum, who was raising concern. There was lots of pressures at that time. It was right in the middle of COVID. There wasn't any access to inpatient beds in Northamptonshire Healthcare Foundation Trust, but they did manage to source a bed within Northamptonshire, and that was within a private provider. But importantly, it was within the Northamptonshire area, which would keep Teo connected with his community. So those factors were good. Also, at that point of discharge, Teo was offered follow-up within 48 hours of his discharge period. And we know that that's a really important high-risk period when people are just at that point of discharge. So following him up within 48 hours was important, and that was by the urgent care centre, urgent care service, who offer that 48-hour service. However, there was key areas of learning as well, and I'm just going to go through those areas. Communication often comes up in safeguarding adult reviews, and this review is no exception, really. Communication was a key aspect of learning in a number of areas. When Teo was in patient care, he was registered with a different GP during that inpatient period, and that was to enable him to have access for primary care needs during the inpatient period. So that was good practice. However, it did mean that there was a lack of continuity of care, and because Teo's admission was short term, by the time he was discharged from hospital 3 weeks later, he was back to his original GP, but the records that covered that period of his admission to hospital, and also importantly the discharge period, there was a lag in that information being sent to his GP practice. So his GP really wasn't aware of why Teo had been in hospital, nor what the care plan was at his point of discharge. There was also a fragmented process between the urgent care service, so that the service that would follow up Teo immediately on discharge, and Teo's care coordinator. Teo's care coordinator hadn't gone into hospital to see him once he was in hospital, and that was partly again because of the COVID arrangements at that time. The Northamptonshire Healthcare Foundation Trust had arranged for their bed manager to have oversight of individuals' cares, but that meant his care coordinator wasn't really at the centre of his care or communicating back to Teo's mum. The care coordinator was due to go on leave and had told the urgent care providers that they were due to be on leave, but that information wasn't recorded accurately. So when Teo had his 48-hour follow-up visit by the urgent care service, he wasn't engaging in that service. There was quite a lot of concerns. His mum was already saying that she was worried his mental health was deteriorating. Teo was walking away. He wasn't really engaging with services, and there wasn't adequate follow-up. And from that visit, the urgent care service also said, "Oh, don't worry, your care coordinator will be visiting on Monday." This was a weekend visit. Well, the care coordinator wasn't visiting on Monday. They were still on annual leave, and that vital piece of information had not been accurately passed over. So there wasn't that follow-up, there wasn't the sharing of that information, that actually Teo hadn't had a really robust assessment, and there wasn't that knowledge across the services that actually nobody would be seeing Teo within that following week period, despite there being some emerging concerns at that point. The other key issue in terms of the communication and concerns about communication was when Theo was found near the train line. This was a week prior to his death. And at that point, there was good practice from the British Transport Police in terms of taking him into hospital. And they'd sent communications out to Theo's GP and also to Northamptonshire County Council, the relevant council area at that time, to say they'd found Theo, they were concerned, and they felt he needed follow-up. Once that information had been shared, it wasn't uploaded onto the system. The GP made some assumptions about that information being seen by Theo's care coordinator, where Theo's care coordinator was still actually on annual leave, and nobody was looking at the shared clinical record in his absence. So that key piece of information, which is really important to know and should have been seen as a red flag, was missed. So that were really the kind of key points around communication. The other kind of risk learning theme was in relating to risk assessment and risk management. So we know that the risk assessment from that 48-hour follow-up should have been really robust in terms of understanding, listening to Theo's mum about what her concerns were, that she wasn't sure if he was using his medication, she felt his mental health was deteriorating again, and he was spending an awful lot of time on his own. He was going missing from home, although that had tended to be his practice. She was concerned that he just wasn't engaging with services. So that information wasn't really taken forward in terms of understanding risks. Key information that Theo had talked to his psychiatrist about when he was in patient care, that being his father, that he believed his father had died by suicide, hadn't also been lifted and recognised as a real risk factor and fed into Theo's risk assessment to inform risk assessment practices. So services should be very attuned to that kind of information, and particularly listening to and understanding things like anniversaries of the person's birthday, anniversaries of death, when there might be heightened risks during that period. So that crucial piece of information wasn't then fed into a risk assessment. And then really importantly, in terms of thinking about risk assessment and management, was the key opportunity when the British Transport Police took Theo into the emergency department, and Theo was seen by a member of staff there. So at that point, what we now recognise is Theo had recently had an acute period of illness. He'd recently been discharged from hospital. He had schizophrenia. He had unstable housing. There was lots of fragility in terms of his mental health, and his mum was concerned about how he was presenting. So bringing that information together alongside the fact that he'd just been found next to a railway line, and we know that that's a really high risk indicator as well, where people might visit those areas of high risk, physically high risk areas, partly to contemplate suicide or to rehearse if they're thinking about suicide at a future point. So those factors are really important to recognise. And the member of staff, although they did speak to Theo and they did say to Theo, are you thinking about harming yourself? Are you thinking about suicide? That's a really important question, but it needs to be taken to the next step. So asking questions beyond that when there's other areas of concern that should be known. And sadly, at that point, those extra questions weren't asked, so that professional curiosity just wasn't there at that point. We don't know what the circumstances were there, and we recognise that for that member of staff at that time, they may well have been dealing with lots of pressures in the system, including managing pressures from COVID at that time. But nonetheless, in terms of thinking about that opportunity for risk assessment and risk management, that was a key aspect which should have flowed through. So the other key area of learning is around understanding carers and the importance of involving carers in people's care. Theo's mum was a real key factor in his life. She was the mainstay of his care. She understood him well. She knew when things weren't going well for him. She knew when his mental health was starting to relapse. So it was really important to listen to her, to involve her in his care, and for her to understand what the care plans were and what her role could be within care plans, and importantly, what the contingency plan was. So although that information had been shared with her, recognising that English wasn't her first language, we know that health and social care is a really complex system to try and navigate, and it was unrealistic to expect her to be able to do that. So she needed to know what's the contingency plan while the care coordinator was on leave. It's also important that she had her own needs met. So under agencies recognising her needs to have a carer's assessment, and that there was no evidence of that having been offered either in the scope period or predating the scope period. It's also important for people to understand the rights of carers, where that carer is also a nearest relative under the Mental Health Act. That's a particularly prescribed role, where that prescribed person of being a nearest relative has rights, and one of those rights is to request an assessment under the Mental Health Act. And Tio's mum was not aware of that right. Nobody had told her of that process.
Thanks for sharing that, Sylvia, and really interesting that you covered the good practice as well during this case. Are there any other kind of missed opportunities in this case that you wanted to highlight, and perhaps what colleagues could do differently in their practice now, learning what we know now?
So I think the missed opportunities were around involving making sure that there was robust planning in that really early stage post-discharge. So with the care coordinator being on leave, having really strong, resilient arrangements to support Tio and his mum during that really important period post-discharge. So I think that was a missed opportunity. And I think the other main missed opportunity really was not recognising the significance of finding Tio next to the train line. I think the police did recognise that as a high risk area, and British Transport Police are well versed in those areas, and sadly recognising that train lines are sometimes where people who are contemplating suicide will use that train line. But I think that information wasn't recognised sufficiently by the member of staff in the emergency department, and really thinking actually people in those roles are really pivotal in those circumstances. When people are in crisis situations, those emergency workers are often those individuals who are called on to respond. So it's really important for them to recognise those kind of red flags and to take that wider view of risk assessment. So that was a real key missed opportunity, I think.
Kind of any key messages that you want to take or colleagues should take away from this SAR? So
I think the key messages probably flow from that, really. If I was to give, three primary ones, really, the first is that suicide prevention is complex. It's a very difficult thing. It's a tragedy. Every suicide is a tragedy, obviously, and reducing the risk of people dying by suicide really is about understanding all of those factors that can contribute. So thinking about factors that build to increase somebody's risk of suicide, but also warning signs and being vigilant to those signs. Risk assessment is a key message, really, in terms of the importance of robust risk assessment. Risk assessment has to be a dynamic process. It needs to examine historic factors. It needs to look at current factors. And importantly, it's about uncovering and bringing together information that might be held in different areas. So not just across multi-agency services, but thinking about what's known by carers who have key perspectives in terms of risk, and helping the person to be able to share for themselves what they view as risk assessment. So for me, it may well be that Tio would never have disclosed his intention. He may never have been able to say, actually, I am feeling suicidal and I've been thinking about how to end my life. We don't know what was in Tio's mind, very sadly. But I think looking at both listening to people, giving people the opportunity, but also linking that into people's behaviours, and also bringing together the information that's held across that multi-agency services is so important. And the third one really links with that. It's about being professionally curious. So as professionals, we have antennae, recognise it, use it, you be professionally curious. When a person's behaviour are raising concerns, and in this case, it was about suicide. So asking the person if they're intending to end their life is an important question. It can be really difficult to ask. It's a really important question to ask. Of itself, it's not enough. When somebody's behaving in a way, even when somebody says, no, I'm not thinking about ending my life, you do need to look beyond that and look at all the other factors that are also relevant, and recognise when you may need to refer on to more specialist services, and seek expertise from mental health services so that they can also contribute to that risk assessment. I think that's my 3 key messages.
Sylvia, yeah, it's the importance of kind of sharing those concerns and not really thinking that actually you have the answers to all this. You know, there are other colleagues that are working with individuals, so pick up the phone, have a conversation. I think that's really, really key, isn't it? Thank you so much. Chloe, I think you're going to share some information where colleagues can actually find the reports and other useful information now.
If you haven't done so already, please visit the Northamptonshire Safeguarding Adults Board website at www.northamptonshiresab.org.uk, where you can read the overview report, executive summary and learning briefing for the SAR. We also have a wide range of policies and procedures available, campaign materials and resources, including an easy read guide, bite-sized learning videos and a list of safeguarding contacts. You can contact the Safeguarding Adults Board by calling us on 01604 365 681 or emailing us at nsab.ncc@westnorthants.gov.uk. We also have an X account at NorthamptonSAB where we share safeguarding messages, news and learning opportunities, so please follow us.
It's really helpful, Chloe. Thank you. Yeah, there's a whole wealth of information on the website, as Chloe says. So yeah, please log on to the website and use those resources that are available to you. It's really important. I just want to thank everyone that's been part of this session today. Thank you so much for your time. It's the first one of these videos that we've done, so hopefully it's of use to colleagues. But for those watching this video in the future, please share at team meetings and in training sessions. You know, it's a bite-sized learning opportunity that will support any of those reports that Chloe's just mentioned. Help raise awareness of the learning and help to make positive change to practice. So thank you.